Number of new confirmed COVID-19 cases is nearing the 9,000 mark. Experts warn the situation is only about to get worse. Well, Lancet Laboratory warns its testing capacity has been exceeded. It's urging patients in category 6 to 10 to not present at their service points for the moment. Now, for our daily COVID-19 update, Professor Adrian Purin from the National Institute for Communicable Diseases will talk to us about that. Adrian, good morning. So let's talk about what Lancet has put out at the moment and just compare with what we were doing before this. What are the changes that you've noted in the communication they've sent out?
Yes, so I mean, as you know, we've always been talking about the capacity constraints within the laboratory setting around testing, and it's obviously become evident with the ever-expanding epidemic in South Africa and obviously in Gauteng specifically, that testing has become a challenge, and therefore the focus of who needs to be tested really needs to be emphasized. I noted Lancet had about a series of 10 types of categories were permitted to be tested, but this is obviously changed, and there's a refocus on, for example, specifically on individuals, healthcare workers, and on those who probably present with symptoms. And excluded from this list, obviously, those individuals who have minimal or no contact, or who are essentially well but may have had contact, and those are, for now, not being tested. So I think we need to be clear who needs to be tested, and it's really individuals who, such as the healthcare workers who may have had close contact with individuals who have tested for COVID and are positive, for example, and or individuals who present at hospitals with specific symptoms, such as acute onset of cough or shortness of breath or severe respiratory distress with fever, sore throat, for example. These are the key clinical signs and symptoms of individuals who, if they present at clinics or at hospitals, should actually be the attention for testing. So any individual who is asymptomatic or thinks he has some mild symptoms, I would really suggest that these individuals not be tested. And similarly, if you have some anecdote of someone being infected, and now you may have had some possible contact with those individuals, again, it needs to be clear what a close contact is. A close contact is someone who has been in touch with an individual who tests COVID positive, who needs to go into isolation, and only when symptoms develop needs to be tested. So I think we're going back to what we initially started off with, really strict definitions of who needs to be tested. Is
there anything that's worrying you particularly about when it comes to the different categories and just where we are placed now with this limited capability?
Yeah, so again, I think, workplaces need to be ready. They need to have a plan as to how they're going to manage their staff coming back to work. So for me, pre-testing going back to work is not necessarily appropriate because, again, if you are asymptomatic, it's really not appropriate that you be tested. I think it's only under certain circumstances that if you present with symptoms, and again, you need to have, therefore, a pre-screening program either before you enter your workplace or at the workplace to actually try and sort out who actually needs attention. And again, in the workplace, it's important to ensure the physical distancing, the hand hygiene, the cleaning of surfaces, all these things are really key in order to try and limit transmission. And therefore, I think the pre-screening questionnaire for me is far more important than simply sending people off to be tested, given the constraints that we have around testing.
Well, I suppose there might be some people who'll be worried and say, okay, I've been in contact with somebody, I don't have the symptoms, I live in the same household with this person, but I'm not feeling sick. But there's always a concern where people say, I was feeling fine up until 5 days later, and then I got deathly ill, and they might go, okay, so how do we prevent that where we get to the point where it might be too late for somebody? Do you see that being a problem with what we're being told now?
Certainly. I think that one needs to manage it appropriately. In other words, if you have come into contact with a person who has tested positive for COVID, then within that household, you need to try and work out how am I going to isolate myself and have practical arrangements around that in order for me to monitor my symptoms, and if they do develop, to actually then go and be tested. But I agree with you, there may well be opportunities where we may well miss the fact that we've had close contact, not aware of it, and then present with particular symptoms. But if you do have the symptoms that I've described, then that's the opportune time to actually have yourself tested.
And I think we just need to be clear that this is just from Lancet at the moment. Other labs have not sent out communication. But do you see it coming? Do you see that, with what we're expecting to happen in the next couple of weeks, that we are really, really going to be stretched to the limit when it comes to testing capacity?
Absolutely. So I think the Western Cape started off that. The Western Cape, in terms of the public health sector, certainly put out clear guidelines for who needs to be tested. And I'm sure that the National Pathology Group, under which the Lancet Laboratory falls under, will probably have similar memos being sent out to the public. And I think within the NHLS systems as well, I'm sure it will be key as to who they will be targeting and focusing on testing. So the key message is keep to your safe bubbles, don't burst the bubbles, and make sure that you don't expose or take risks that are unnecessary. And don't go and test if you are asymptomatic. All
right, but just keep an eye out for those symptoms if they do come through a couple of days later. Thanks very much, Adrian Purin, as always, very informative there. Well.